As the name suggests, the adult mental health unit at the Canberra hospital was designed to provide a therapeutic setting for adults requiring mental health care that can't be provided elsewhere. Consumer advocates who have inspected the facility to provide feedback to committees say, for that purpose, it's appropriate.
People get in crisis and they need to be medicated and managed and kept safe, and other people keep safe. So it's a good unit. I've got a lot of respect for the leadership on the facility.
However, a provision in the care unit's health model allows the admission of children as young as 12. And advocates like Paul say, when it comes to kids, it's certainly not the place they should be.
It's not ideal. I mean, the general cohort is from 20s upwards, and so it's not a question of what appropriate programs are there. I think it's a question of safety.
There will always be unusual cases, and we will always need the flexibility within our mental health services to be able to meet individual needs.
With that in mind, a new adolescent mental health unit and day service was scheduled to open in late 2021. But Canberra Health Services says after consultation, it was decided to co-locate that unit with other adolescent services at the Centenary Hospital for Women and Children, and it won't be completed for another 16 months.
There has been increased pressure on our hospitals and increased pressure on space within our hospitals to make sure that we can care for people safely, even if they are COVID positive. But we are on track to deliver by June 2023.
Some workers at the adult mental health unit fear, in the meantime, children are falling through the cracks, with a 13-year-old admitted to the unit last week. The health worker who spoke to the ABC on condition of anonymity told us when they found out an adolescent that age had been admitted, they were in disbelief and they had serious concerns that staff don't have appropriate paediatric training or equipment to deal with the child, particularly in the event of an emergency. With the government having allocated funding as far back as 2008 to design an adolescent and young adult mental health unit, the opposition argues a dedicated facility should have been completed long ago.
It's completely distressing to hear that our children are being admitted to the adult mental health unit. That's distressing. We all know that the adult mental health unit is no place for a child.
Mental health educators say the location isn't as important as the services provided.
Will they have access to a paediatric psychiatrist? Will they have access to paediatric mental health nurses?
Canberra Health Services insist those services are on hand and young people are moved to a paediatric ward or discharged as soon as it's safe and appropriate. Where they'll go if they need further acute treatment for now, though, isn't certain. Harry Frost, ABC News, Canberra.